Good afternoon. I'm Dave Debo, News Director at WBFO, your NPR station. This is part of our ongoing mental health initiative with the support from the Patrick P. Lee Foundation. We're looking at your mental health during COVID-19. And today we welcome adolescent and child psychiatrist Dr. Aimee DiPasqua from Spectrum Health and Human Services. Doctor, thanks for joining us. Glad you're here.
Sure. Thank you for having me.
As this program goes on, we will get to all the different age groups. We're going to be talking about children's, teens, high schoolers. But I want to start by looking just in a general sense at teens. And if people want to join us online here on Facebook, get your comments ready. You can start posting now, and we'll eventually get to it. But let's start by talking about teens. How are teens or kids different from adults?
Well, teenagers are in a different stage of development altogether. And, once we go from teenage years into young adulthood, our development continues even still up into, our 80s. But teenagers are in a really unique spot because right now they're trying to form close friendships and intimate relationships and kind of putting together who they are. And those relationships are really key to their development right now. And because of COVID, we sort of plucked them from that environment where they're able to foster those relationships. So I'm really glad that you're doing this series because I think mental health is extraordinarily important. And just 20 years ago, we wouldn't be having this conversation about how COVID would affect our children's mental health. I think it's great.
And you're saying that for them right now, a lot of what they do is sort of establish their own identity. Talk about the role that the peer group has in that. If I'm at home and not seeing my friends, I'm probably having a harder time of establishing who I am because it's part of that relationship that I assume is no longer there if they're not in school at this point.
Right. So like, someone was peeking in on me.
That's okay.
The kids, the teenagers are forming these relationships, and in the younger years, middle school, those are the ones that are really trying to really form their identity. That's why we have these clusters of girls who look all exactly the same. They dress the same in groups of boys, and they're trying on different hats to see who they are. So, middle schoolers are having that sort of task or goal developmentally, and then high schoolers have kind of put it together a little bit more, kind of know who they are, but now they're looking for their tribe and they're trying to connect with people. And then we kind of pulled them home, but we needed to be safe. And I just think that we need to really try to encourage our teenagers and middle school children to have phone conversations with their friends, text their friends, FaceTime, Zoom, whatever it is that you need to do to feel connected, because loneliness is a problem, especially during a time like this.
It's interesting that you say that because I and maybe this is probably the stereotype, but I picture kids, teens being socially connected 24/7. You got your TikTok, you got your Twitter, all of that.
I do too.
Without school, are they still making those kind of connections?
Well, the kinds of relationships or the kind of connections you make with Snapchat or TikTok or Twitter is really it's superficial, What I'm talking about is maintaining relationships where you can really be yourself. You can be your authentic self with someone else. And it might not be a whole group of people. If you only have one or two friends who you can do this with, I think that I would consider you lucky. So that sort of superficial connectedness isn't what I'm talking about. In fact, there's some evidence that sort of thing can make you feel more anxious or more isolated for some reason.
Sure.
So no, I'm talking about FaceTime, like what we're doing here, sitting outside in the yard, talking to neighbors as they go by, just working on our real relationships.
And that you say is really a crucial part of their development. When I think of child development, I almost think of, say, a pre-K or an elementary school kid. Talk a little bit about how development continues, certainly in middle school, but yes, even in the high school grades.
Right. So, the younger kids, starting with the ones who are in grade school, they're trying to like master their environment. They're trying to say, hey, I went to school, I'm a schoolboy, or I played baseball and I can follow the rules, and I know how the world works, and they're trying to put it all together, and then when, as you get into middle school, you're sort of figuring out like, okay, this is what I'm about. I think in high school, you're forming intimate relationships, closer relationships. This is like, I feel like our high schoolers were like this big mass of trees and growing together, and their roots were entangled. And then we kind of like plucked them from there and put them in our own little potters and brought them home. And now they're kind of like, are they going to do okay? I'm sure they will, but they take a hit. We all do. We're all home. We're all isolated. That could go for the same for both you and I. We're removed from our coworkers. It's like, I like to think of high school as their job. It's their whole world right now. Their friends and school is their whole world right now, and we basically laid them off.
And there are some people, I imagine, who in adulthood define a lot of themselves by their jobs, but not necessarily everyone. With the kids, they don't have other ways. It's all school, isn't it?
It is. I mean, unless you're part of Girl Scouts or Boy Scouts, or you're part of a dance troupe, you can identify yourself through there and your friendships through there, of course. But I think school is the main center where we form those relationships. One of my close friends homeschools, and even that community, I know they get all of their kids together, not during COVID, but
Right.
during the school year, they get their kids all together to do things because socialization is that important.
And even though right now they're probably doing less, or maybe seeing less of their friends, talk a little bit about how overwhelmed they could be, regardless of the fact that they might be just sitting at home in their room with their phone.
Right. So, it's feeling overwhelmed or lonely or isolated is an odd thing, because it's quite possible to feel that way even if you are surrounded by people. So check in with your teenager, check in with your kids to see how they're doing. If they're in their room the whole time, isolated away, and they have their phone or their iPad, and you don't see them for long stretches of time, if they're talking with all of their friends and they're, watching movies together or playing an ongoing game of charades or something, that's really a great thing, because they're connecting with their peers. If they're in their room and they're watching sad movies to try to get their feelings out, you want to know what's going on in there. So pop your head in and say, everything okay? What's going on? Or, I don't want to like do a commercial for Oreos, but like bring some cookies upstairs to them and say like, I just brought this for you. Check in with them, because feeling lonely or feeling overwhelmed looks different on different people. And some kids,
Sure.
they could look really irritable, which
go ahead.
Yeah, it brings me to my next point, which is I wanted to let our audience know what to look out for in their children, not only like now during COVID, but this goes for like any time. Irritability, and irritability is part of development and adolescence, but I'm talking about irritability that goes above and beyond that. Parents, whenever I say, oh, are they kind of crabby with you, they laugh, they roll their eyes. Yeah. But I'm talking about really, really bad, where you're kind of tiptoeing on eggshells. Your family is restricted in terms of what they can do. You cancel plans because so-and-so is going to have a rage when we get someplace. So that kind of irritability is really important to address with your doctor, or a counselor, or a child psychiatrist.
I don't want to get myself in trouble here. You're saying different from the everyday crabby teenager, and even more crabby teenager.
Yeah, I'm not talking about average level of saltiness. I'm talking
Okay.
about extreme saltiness.
All right.
Yeah, you'll know because this is the kind of thing where you feel like you might feel like I can't talk to people about it. There's like for some people, I think there's a lot of shame in asking for help when you have a child who is struggling.
Sure.
Sometimes parents blame themselves and they feel like they've done something wrong in rearing this child, and that's why they're having such a hard time. And that's not always the case, and people really do care. And you're not alone. There are a lot of resources out there.
Oh, You're one.
So
You're
mhm.
one of the resources we have here. If folks want to join in and share their comments, what are
Okay.
they seeing? Maybe their kid is acting out. Maybe they're just trying to adjust to the new schedule. Whatever comments you have, leave them here on Facebook, and we'll try to get some discussion going. We did have, Aimee, a comment that came in before the program. I want to read you
Okay.
this and get your reaction to it. If children do not go back to school this year and are expected to start the next grade in September, what kind of emotional repercussions could children who are at the important transitional stage in their schooling have from the experience? And the person that wrote in has an example here. My daughter is in the 5th grade and is terrified of middle school without saying goodbye to her beloved elementary school, where she has now missed so many special 5th grade milestones. What
Yeah.
jump on in?
I I think that we can expect to see rising levels of anxiety in our kids as they return to school in the fall, especially if there was already anxiety there. I would hope that kids who are making a transition from 8th grade to high school or from 5th grade into sixth, a change in the school, hopefully they'll still do a meet and greet. Maybe the school districts will take it a little bit slower, understanding that those particular groups of kids didn't get as much time to transition, just to just to process that change. So hopefully it'll take more time, but I would anticipate a couple of speed bumps there. And if your child starts complaining or really seems out of it emotionally before school starts, the weeks leading up to it, if you're picking up on a lot of anxiety, I would encourage you to reach out to a counselor and get them in, even if it's only for 4 sessions. At least that someone else has an eye on your child, and they may be able to impart some coping skills that your child can use going back to school. I every single patient I've talked to, every single kid in the last month has told me they feel overwhelmed. Every
Sure.
single one. They open up the emails from the teachers and they just feel like this wave of anxiety over them because, there's these assignments due and they're due, and I think they feel like I know they're not on their own, but for them, I think they feel it.
So, what can a parent do in a very general sense? How do they ease those fears?
Well, anxiety, if someone were to say, like, I feel really overwhelmed and mom, I can't, I'm just freaking out. And you want to acknowledge that and validate it rather than, yeah, the natural instinct as a parent is that you want to allay their fears, but really, like, how can you take it away? If I had a magic wand to do that, I would do it straight away for every single kid I see, but what we can't. So what we can do is hear them and validate their feelings, acknowledge, like, yeah, this is a really anxiety provoking time. Let them vent. If you feel the urge to sort of say, like, well, if resist the urge to sort of like use this as a teaching springboard, like, well, if you had been keeping up, then you probably wouldn't be feeling like this or something. It's
Uh,
just not their
yeah.
kids are feeling fragile right now and they just need to be heard.
All right.
um yeah.
In a lot of ways, I think what you've kind of described is grief.
Yeah, especially the poor seniors who didn't get a chance to have all of their celebrations. And um losing there's so many different reasons to feel that grief. You know, they have the loss of like the celebrations, and then they're pulled from their friends. So I would say, yeah, I would acknowledge it,
Okay.
and it's
I want to talk more about how to acknowledge it, maybe even what parents should and shouldn't say. If we could, let's do some role play. I'm the kid. You're the therapist, the person that knows what the parents should say. I know that not every kid is the same, so a lot of what we're going to do here, obviously, is generalizations. But give me some good examples of how a parent should respond. Let's say I say to mom or dad, "I'm sad and I miss my friends." What should the response be?
I would say, I know you, if you were my son, I would say, I know you do, buddy. I know you
Hmm,
haven't seen him in a while, huh? And then I might say, what about like reaching out, you know,
okay,
you know, um, which brings me to my next point. If they don't have their phone, you might consider giving them like more leeway, more free time with that, so they can
sure.
reach out to
Here's another one. You need the kid to do something, and they say, "Well, I'm not in school now. I don't have to do that now." How do you get over that sort of hurdle?
you. Well, it's tough. I feel like if you have a good foundation, with your kids, um, from the beginning, it's going to be easier to motivate them to do work. But I would say encourage them to just do small chunks rather than look at like this large group of assignments. You might consider taking them out for a reward if they do really, if they really apply themselves. I think just encouraging and breaking it down into small chunks. If you do the whole group of, if you look at all of the assignments at once, people are just going to get overwhelmed. You
Yeah,
know, make sure they have like their own room, their own space. Try to keep like the other kids, the little ones, in a separate area so that your teenager or your younger kids can focus.
it is cliche. But when my kids were stressed, and they're both in their 20s now, but when they were in school and they were stressed, we do exactly what you said. You eat the elephant one bite at a time. The idea that
Yeah.
it's not just an entire big project. Break it down into chunks and maybe address the chunks.
Yes.
We have
Definitely.
had a couple comments start to come in. Lisa writes on Facebook now, thankfully, educators and support staff are expecting this. They know what has been lost and will be meeting them where they are. That kind of looks ahead to the future and the idea that this is eventually an okay thing, no?
Yeah, I think that I'm so thankful for the resources kids have at school because um, they're going to be there sort of waiting to receive these kids, and they're going to know what to expect.
Hmm.
I just hope that they don't get like, I hope they don't get flooded.
Right, right. I
But
do want to
they're
pick up. I want to pick
mhm.
up on something you said earlier there too. The idea that perhaps now is not the time for mom or dad to be the disciplinarian. That there should maybe be some moderation. Address that. Talk a little bit more about that.
um I just feel like right now every parents are home. We have our own financial worries. We have our own stress level. So you have to acknowledge that you might be a little bit more short with your spouse or with your kids. So we have our own stress level, and then as a parent, you might not have the same level of tolerance you had before because it's during a time of stress. Um, but if there was ever a time where they need some, a wide berth, it would be now, because if you drop the hammer and say like you're getting your phone only from 7 to 8 every day, that's it. Your kid may feel isolated and angry because you cut off their lifeline. So if you're going to dole out a punishment, I would really encourage you to just do it in really small chunks
All right.
rather than like a whole day without your phone. Maybe consider just doing like half a
All right.
day or a couple of hours for younger kids, just a couple of hours at a time.
Dr. Aimee DiPasqua is here. Let's go to the Facebook comments coming in now. Excuse me. Tara asks about parents of children who are doing better emotionally since beginning remote learning. They have decreased anxiety, more sociable and pleasant at home. She worries about those children reintegrating once this is over.
Yeah, I don't know. I feel like if you're really attached to your parents, then when you're home, you're going to be happy and really flourish. But having a really good attachment with your parents isn't necessarily indicative that you're going to have anxiety when you return back to school. It just means that like you're in your happy place around your parents, and that one-on-one attention is really helping you flourish. They might do well after having so much emotional growth when they go back to school.
All right. Kate is asking us now again on Facebook, what do you think kids spending more time on video games online with friends? I find myself torn between limiting them like I normally would and letting them play on it more because it's the only way they seem to be able to socialize.
Yeah, that's a great question. And so practical. I'm giving my own son way more time on Xbox because I want him to talk with his friends while he's playing online. If he's got his work done, I see no problem in giving them more time than usual. He used to have less than 2 hours a day, and now he's playing maybe, I don't know, close to 4. It kind of depends on the day and whether his friends are online. He only wants to play if his friends are online. That's the key because it's a social thing.
And
So
you're
I
okay
would
with that?
say, yeah, I am okay with that, and I would encourage other parents, to maybe loosen the reins on it a little bit if it makes your child happier. If you think that they're socializing and their behavior is good, there are some parents who say that playing games makes their child more irritable and things like that. So obviously, if that's the case,
Sure.
you want to reconsider that. But if it's something that really works out for them, I would think about it.
And are there other places where the parents should really back off to, besides just like say on time on video?
Phone use, texting with friends, chatting with friends. I can't say anything about you know going out or anything like that, but the electronics use, I would say, yeah. And I would say if your child's a little bit more emotional too, like I would kind of roll with it
And
because they're
go ahead, I'm
stressed
sorry.
out.
And
Yeah.
I would bet they're probably sleeping more too.
My teenager is sleeping in, and I'm really, really happy about it because I've long since believed that we need to let our teenagers sleep in the morning. The American Academy of Pediatrics, put out a statement, I think several years ago, about how our teenagers aren't getting enough sleep and we should let them sleep in the morning. To be clear though, I'm not talking about staying up at like until 1 or 2 in the morning and then waking up at 2 in the afternoon. I mean, if they're going to bed at a reasonable time and they're still sleeping at 10 or 11, I say let them sleep. Their brains are still developing, and there's a lot of things that are going on hormonally while you're asleep, and they just really need that time to grow. I was saying before to one of my friends that I think that this particular group of kids who were teenagers during COVID, this cohort, if we measure their height in like 5 years, all these kids are going to be taller because they had so much more growth hormone released. It's going to be a COVID kid. He's tall.
It's almost a little bit of a distraction off our main topic here. But you think the school day should be shorter, start later, something along those lines?
I think high schoolers should be allowed to sleep in and go in later. I think if you're going to send someone to school early, it's probably the little kids. They're up so early, but teenagers, they need to rest. This is a scientific fact. It's been studied. They do better when they have more sleep.
All right.
Um, so yeah, I would send them in later. I think it would be better for them and their mood.
All right. Aimee DiPasqua is here. She's a child psychiatrist with Spectrum Health and Human Services. We're looking for what you're seeing in your home. How are you adjusting? How are your kids adjusting? Throw us a comment on Facebook and we'll get to it. Thus far, we've talked a lot about the high school kids. Let's move into the younger ones. Let's say kindergarten through fifth grade. How do you explain COVID to an 8-year-old? And I know that's tough.
Um, yeah, I want to say something about like explaining illnesses to kids, or in general, like in a crisis, like what you present as a parent is really what your child's going to pick up on. It reminds me of when you have a toddler and they're running and they fall, and then the parent goes, "Yay, it's okay," because they look at you to
Mm.
see whether or not you're going to cry, to see what your expression is. You know what I mean? So So they're going to look at you right now to see, like, holy cow, is this really a bad thing, or are we going to make it okay? I would say, all children know about germs. They know about washing their hands and sneezing into their arm. So I would explain that this is like a super bad bug. I would even maybe like make it kind of like a villain, something that we're going to beat. And this is how we beat it. This is what we do. We
Kids
stay
love
home.
villains.
Yeah, they love villains. This is what you have to do to beat this particular villain. We have to stay inside until we get a special medicine to get rid of it. We got to wash our hands if we go out and wear a mask if we go out. And you can even make posters and signs and make a picture of a critter and then put a big X through it, like, we will beat you. Have them posted on the windows to support people. Give one to your mailman. Kids know about germs. We just need to explain that this one is kind of like more tricky and a little bit more nasty than usual, and it can make you really sick. But we're going to be healthy, and we're working on
And I don't want to oversimplify it, but you're making it fun. And if it's fun, they'll see, oh, mom and dad are at ease about this.
Well, I don't want
They
you don't
really
want
kind
to
of
you don't want to scare them half to death. You don't want to tell them, the mortality rate or about intubation and how very bad things can be, because that would really scare them. And I don't think that you have to scare them in order to impress upon them that it's serious.
Hmm.
That, which brings me to the news. If you're going to be talking about COVID, you may want to have these conversations behind doors with your spouse. If you're going to talk about, so and so died, or so and so was intubated, and just try to keep up good boundaries between you and your children. Same thing with like finances. You're stuck because you're home from work. Car payments are going to be late, mortgage payments, but kids pick up on
but they
that.
don't need to hear. Yeah,
I've had
they
really
don't need
young
to hear that.
Yeah, little kids have told me, like 9, 10-year-olds have told me, like, I just worry, um, I worry, like, if I ask them about their birthday party, they're like, no, I don't want to spend any money because, things are tight right now. They'll say that to me.
Because they've picked up on what mom and dad were worried about.
Yeah, they pick it up. They just they're listening. They're always listening.
How do you read them? If it weren't for the kind of comment you just spoke about, how do you know when they're bothered?
You mean about about COVID, or if they're anxious or upset?
Exactly. I would imagine, and this is where you're the expert, I'm not, but I would imagine they're not going to say, "Hey, mom, I'm really concerned about this COVID thing." That
Oh
that
yeah.
that that you have to be able to extrapolate and pull something out. What do you look for?
A change in your child's behavior. You know them best, better than anyone else. And if you pick up on a slight change, um, in terms of like how they used to play with their toys a lot, they used to really like to go on the trampoline and bounce, and now they're just kind of laying around, not really into playing with their toys. If they're irritable, irritability is a sign that their mood is off, or there's anxiety there. Poor sleep, change in the appetite, increased tearfulness. Talking about this is for children and also adolescents. As you get up into adolescence, any talk about suicide, even in passing, even if it's light, like if someone says like, yeah, my life sucks.
Yeah,
You
yeah.
know, you want to explore it with them. Obviously, any self harm, like any self injury, is a concern and should be talked about with your child.
Okay. Sarah on Facebook just wrote in. She says, "My child gets anxious when he feels like we're holding back information. He actually asks to hear Cuomo's daily briefings. We also don't have a large living space, so it's impossible to hide conversations from him. What's the person to do?"
I'm not sure. Thank you for that question. I'm not sure how old he is. Um, Cuomo's daily briefings, I've watched them. He's generally he he doesn't say so many things that are scary. I think that holding information back and the child getting anxious, I think that's totally true. If you don't acknowledge that anything's going on and you say everything's fine, like if you don't tell them anything, they know that something's going
Oh
on
yeah.
and they will become extraordinarily anxious. So I would acknowledge that, yeah, something definitely is going on and tell them about COVID, but this is, it's the adult's job to worry. That's my job.
Mhm.
My job is to take care of you, and you have to let me do my job. When you're older, you can worry about your kids and the state of affairs. But right now, I'll watch the news. If anything really important comes up, I'll tell you. Um, it's hard to say because you don't really know what they're going to say on the news. On occasion, you get surprised. So,
Sarah,
um,
I want to have the person on Facebook, Sarah, tell us her son or her daughter's age. There's a little bit of a delay in Facebook, but
okay,
if you
so
can
he's
type on in
super
an
right.
answer,
He's 6.
we've just okay. Producer Lynn has just told me he's 6. Does that change your answer?
Yeah, it's funny because I haven't watched Como in a little bit, so I think it's just too much for them.
Mm.
I do. Ultimately, you're the parent, you make the decision, but I would explore why they want to watch. What are you worried about? What do you want to learn about? Maybe I
Well,
can answer that for you.
part of that is in her initial comment here. She said, "My child gets more anxious when he feels like we're holding back information."
Yeah.
To me, that's maybe the nugget where you have to let them know that there's some things that they shouldn't. I don't know.
Mhm.
Do you not tell them things and
You
acknowledge
filter
that
it.
you're not telling them?
You filter it, like I think the saddest part about COVID is that when there's people who are really ill, they're alone. Their family can't be with them. For me, that is the most heartbreaking part, and that kind of sadness and that kind of grief, I don't want my child to experience that until they absolutely have to. And
That's
so I don't know. I would rather not expose them to that because I think it wouldn't serve a great purpose. I think it might. I don't know. I think it might increase their anxiety because I, I don't know.
okay.
I would filter the news.
And I don't want to dwell too long on this one comment, but again, because of the delay, we're just getting more information here. He not only is he 6 years old, but Sarah says he's fairly precocious.
Mhm. Yeah, so you got to give them something, but don't let them have it all.
Okay,
Maybe if you're watching a replay of the news, so you know what they're saying, it would be better than watching something live because live something
sure,
just
sure.
yeah.
All right. Dr. Aimee DiPasqua is here. We're welcoming your comments on Facebook. We're talking generally about some of the mental health issues that children and adolescents are facing at this time. We'd love more comments as the program goes on. And obviously, one of the things that most people are dealing with is education from home, the whole homeschooling learning thing. Give some parents hope here. What's your advice?
For the education component at home.
Exactly. Parents are probably at their wits' end. The kids are in high school. The mom or the dad might not know algebra as well as they should. There are parents probably of younger kids as well. In a general sense, what's your big piece of advice there?
My first piece of advice is to be kind to yourself and give yourself a little bit of not not a break or a pass, but you need to be compassionate with yourself because you're at home and you've suddenly been turned into the teacher and you might even be working from home. This is
Mm.
not an easy feat by any stretch, and it's going to be a challenge. So you have to keep your expectations realistic. Maybe don't have like visions of teaching them. I can't even think of an equation to teach, but you don't have to teach them these extraordinary things. I would say try to, especially for the younger kids, I would try to keep them at least at their benchmark where they were when they entered COVID. If they were writing their name on the paper and their penmanship was coming along, try to remember where they were at and try to maintain that.
I don't want to pry too much, but give me an example from what you're dealing with. You said earlier you've got kids at home. You're probably having the psychiatrist hat on sometimes and the teacher parent hat on other times.
Yeah.
Talk about what it's like for you.
So my youngest one will say that he's done his work. Oh, he's going to be so mad when he finds out I did.
This is
He'll
one of
say
those
like,
things
yeah, I did it.
this is one of
Yeah,
those
I did
things
that. I
we
turned that
scream
in.
from him. He's not watching.
What happens on Facebook stays on Facebook.
Right, exactly.
So, right. So he'll say like, oh yeah, I did that assignment. I turned that in. And then my husband and I will check and it's not actually submitted, or he did some, but not all. So 6th graders, 7th graders, this goes even for when it's not COVID time, they still need us watching over their shoulder and saying, I think you should recheck that, or do you need help with this? We can't totally hold their hand. We have to start giving them a little, freedom. And then
Yeah.
as they get to 8th grade, you're really hoping that they're starting to, take charge of their homework and stuff. But
Yeah.
so at home, we're still having to watch over the shoulder and make sure things are getting turned in. Even for our 8th grader, same thing. She's more self-directed though. And then our high schooler's mostly on autopilot. She's doing okay.
Yeah. Mine were in middle school and high school long before COVID. They're in their 20s now, and I really relate to what you said about it. It being something where the kid has to be self-directed. And yeah, Dad, oh, I did my homework. Yeah, you don't have to take a look at it. It's done. So
and sometimes they are.
that's my hope they're not watching Facebook Now story, because
It's just
I can picture this being a problem with COVID, obviously, but even way before it.
Yeah, right, exactly. So you know your child's style, most likely you know their style. So
Sometimes I wish I didn't.
follow, follow your hunch.
All right. I want to bring in another comment. This one came in before we were actually on the air here. My question is about children who already struggle with anxiety and perfectionism. My first grader is advanced for his age, was benefiting a great deal from a gifted program in the public school. Now that he's home doing lots of busy work and having no interaction with his GT teacher, he's getting bored and also frustrated with himself with all the pages of work that spike anxiety and don't reward his curiosity. Before, I did a lot of enrichment in addition to the homework. Now I'm just trying to get him through the basics as I work and care for a toddler too. How will this time impact children's views of school and learning in general?
Working at home with a toddler and did you say 5 or 6?
Yes.
That's going to be really difficult. I applaud you for getting his work done with him, just the plain paper, just you said the basics, getting those done, we have to do it, and he gets bored with it. I think it's interesting though, because a lot of times we're so good about keeping our kids entertained and giving them enriching experiences, but I think sometimes too, being left to explore and think and being bored sometimes is a good thing. It leads to creativity. When I take away my kids' electronics, they end up building crazy things out of Legos, and the artwork starts to roll in. So I don't know. I would kind of encourage you not to feel so bad about giving him free time left to think or just to play.
Okay.
Playing is their job. We were talking about high schoolers and how their job is to connect with friends and socialize and make intimate relationships. The job of the elementary school child is to play, and to learn and to master their environment. But I would say not to feel too bad about the loss of those enriching experiences, because when he's back, he's going to flourish once again. That's not going to be different about him.
Okay. It's interesting too that you mentioned master his environment. A couple weeks ago when we were talking about stress, one of the basic pieces of advice for adults going through stress was the same kind of thing. Bake a loaf of bread because it gives you a sense of accomplishment. Do some gardening, because if gardening rewards you, you can say, gee, look, I did my gardening. Mastery is important here, especially with the kids.
Mm-hmm. Yeah, exactly.
Do you have any resources for us? Where can people learn more? What should they read? What should they do in order to brace themselves up for this time?
The website that I really like to refer families to is called childmind.org. It's an organization out of New York City. They have a really great webpage. It's childmind.org, and they have all of the different tabs for anxiety, depression, bipolar, medication, resources. It's just a really great website, and I think that I would check it out to see what tips they have.
All right. We'll put that link in the comments. Again, it's child what? Let's make sure we can write it down.
Childmind.org.
Childmind.org. Okay.
Mm-hmm.
We'll throw that up in the comments as a reference.
Yeah.
We are getting another comment just came in now. Again, it's Tara, and she asks, what advice do you have for parents who have middle school children who are overwhelmed with the workload? They're becoming agitated because they can't see their friends. They're stuck at home with a lot of assignments. Should the parent allow some flexibility with assignment completion, or should they maintain that all assignments have to be completed?
I think that I would let them do some of it. It's kind of like, I don't mean to compare this to eating, but it's kind of like eating, saying like you have to complete all the assignments is saying like you have to eat all the mashed potatoes. Like at the end of the day, you really can't force a child to eat, and it really results in a terrible power struggle, which you want to avoid.
This might be another one of those Facebook stays on Facebook conversations. I don't want to have you blow your teachers in, but are teachers understanding of this sort of thing? Or are they banging their fist and saying, darn it all, 3 assignments a day is 3 assignments a day?
We're more like, if it doesn't get done, then we'll work on it. We'll keep working on it and turn it in as soon as we can get it done. It's not like it goes away into the abyss and they're not responsible for it. But if one of my kids is struggling, we'll say, well, we'll give the teacher a call or an email and say, hey, we're still working on this. We didn't quite get it done. We'll let them know, So, and I think that most teachers are really reasonable, and they would respond to an email or a phone call that says, hey, we're struggling with those last 3 pages of the packet, and would it be okay if next week we got it to you? But communication is the key. You got to pick up the phone and call them,
As we wrap up here, I want to get your sense of the future. How does all this play out? Look down the road, maybe 6 months after we're back in school, or even a couple years when all of this is behind us. What do we have to know? How does it play out? What's the future look like?
I think that in the future, we're going to look back on this time and say, like, I can't believe we used to go into airplanes without face masks. I can't believe we used to go in taxis and buses without gloves. Our grandchildren, my grandchildren, I'm going to tell them, like, when I went to school, we didn't have to wear gloves at all. We never wore a face mask on the school bus. And like, ugh, that's so gross. It's going to be normal.
I think of 9/11 when there were before 9/11 when there were no airplane screeners, the same kind of thing.
Right. I think we're going to have to get our temperature taken before we get on the airplane in the future, and probably pass through some kind of like lighting apparatus to burn off any germs or something. I have no idea, but I think that there's pre-COVID and post-COVID, and the world is going to be different, but we'll adapt to it just like we adapted, after 9/11. You grow with it. The world changes, you grow with it.
All right. That's probably the best spot to leave it. Thanks so much. Dr. Aimee DiPasqua is a child and adolescent psychiatry specialist in Orchard Park with Spectrum Health and Human Services. Thanks for being here. This was great. And again, we'll have resources up in the comments section. So if people want to learn more, they can certainly hop on Facebook and watch this again as many times as you like. Share it with your friends, pass it around. Thank you, Dr. Pasqua, for being here. I really appreciate it. Before we go, I do have to say some thanks to producer Lynn Bader. Our social media coordinator is Johnny Moran. Thanks, obviously, to the rest of you for joining us. Make sure you come back next week. We're going to look at seniors in isolation next Thursday at 4. Put it on your calendar. Join us. Set some time aside. Your mental health during COVID pandemic is part of the WBFO Mental Health Initiative with support from the Patrick P. Lee Foundation. I'm WBFO News Director Dave Debo, and we'll see you again right here next week. Thanks.